According to National Fire Protection Association 17 National Electrical Code, a patient care area is any space intended for the examination and treatment of patients. Since exam rooms are specifically intended for the examination and treatment of patients, they are considered patient care areas. Article 517.13 of the National Electrical Code specifies wiring methods for patient care areas. These methods include, firstly, the use of grounded metal raceways, cable trays, and enclosures. Secondly, equipment grounding conductors sized according to Table 517.13. Thirdly, bonding of all conductive surfaces within the area. And fourthly, use of ground fault circuit interrupters in specific locations. Since exam rooms are patient care areas, they must follow the wiring methods specified in Article 517.13. This means that the following must be used: firstly, grounded metal raceways or enclosures; secondly, properly sized equipment grounding conductors; thirdly, bonding of all conductive surfaces; and fourthly, ground fault circuit interrupters in the appropriate locations, such as above the hand wash sink. Exam rooms are considered patient care areas, so they must follow the wiring method specified in Article 517.13 of the National Electrical Code for redundant grounding. This includes using grounded metal raceways, properly sized equipment grounding conductors, bonding all conductive surfaces, and installing ground fault circuit interrupters in specific locations. To elaborate further on the specifics of Article 517.13 and its implications for exam room wiring, firstly, let's consider grounded metal raceways and enclosures. The purpose of using grounded metal raceways, such as conduit, or enclosures, such as metal boxes, is to provide a low impedance path for fault current to return to the source. This is a critical safety measure, as it helps to ensure that overcurrent protective devices like circuit breakers or fuses will quickly trip in the event of a ground fault, minimizing the risk of electrical shock or fire. The metal raceway or enclosure must be properly grounded, typically by connecting it to the building's grounding electrode system. This connection should be made with a properly sized grounding conductor, and all connections must be mechanically sound and electrically conductive. Secondly, the proper sizing of equipment grounding conductors is crucial. Table 517.15 in the National Electrical Code provides guidance on the appropriate size of the equipment grounding conductor based on the rating of the overcurrent protective device protecting the circuit. It's important to consult this table to ensure that the equipment grounding conductor is adequately sized to handle the anticipated fault current. An undersized equipment grounding conductor can overheat and potentially fail during a ground fault, compromising the safety of the electrical system. Thirdly, bonding of all conductive surfaces within the patient care area is another essential requirement. Bonding refers to the practice of connecting all metal parts, such as metal sinks, door frames, and medical equipment, together with a low-impedance conductor. This creates an equipotential plane, which minimizes the potential difference between different conductive surfaces. In the event of a fault, this helps to prevent electrical shock hazards for patients and medical personnel who may come into contact with these surfaces. All bonding connections must be secure and electrically conductive. Fourthly, the use of ground fault circuit interrupters in specific locations is a key component of electrical safety in patient care areas. Ground fault circuit interrupters are designed to detect even small amounts of current leakage to ground, typically on the order of 5 milliamps. When a ground fault is detected, the ground fault circuit interrupter will quickly trip, interrupting the power supply and preventing electrical shock. The National Electrical Code requires ground fault circuit interrupters in specific locations within patient care areas, such as near sinks and in other areas where there is a high risk of water exposure. This helps to protect against electrical shock hazards in these potentially wet locations. To summarize the requirements for wiring exam rooms as patient care areas under Article 517.13 of the National Electrical Code: firstly, use grounded metal raceways or enclosures for all wiring. Secondly, ensure that equipment grounding conductors are properly sized according to Table 517.13. Thirdly, bond all conductive surfaces within the exam room together to create an equipotential plane. And fourthly, install ground fault circuit interrupters in all required locations, such as near sinks. By following these requirements, electrical contractors can help to ensure the safety of patients and medical personnel in exam rooms. Also, consider supplemental grounding, although not explicitly required by Article 517.13 in all cases. Supplemental grounding can further enhance electrical safety in patient care areas. Supplemental grounding involves installing additional grounding electrodes and connecting them to the building's grounding electrode system. This can help to reduce ground impedance and improve the effectiveness of the grounding system. In some cases, supplemental grounding may be required by local codes or by the facility's risk management policies. Another concept is isolated power systems. In certain critical care areas, such as operating rooms, isolated power systems may be required. Isolated power systems are designed to prevent ground faults from interrupting power to sensitive medical equipment. These systems use an isolation transformer to create an ungrounded electrical system, which prevents current from flowing in the event of a single ground fault. Isolated power systems are typically used in conjunction with line isolation monitors, which continuously monitor the impedance to ground of the isolated power system. If the impedance drops below a certain threshold, the line isolation monitor will alarm, alerting medical personnel to the presence of a potential ground fault. Also, surge protection is important. Surge protection devices can help to protect sensitive medical equipment from damage caused by voltage surges. Voltage surges can be caused by lightning strikes, utility switching, or other electrical disturbances. Surge protection devices are typically installed at the service entrance and at branch circuits feeding sensitive equipment. They work by diverting excess voltage to ground, protecting the equipment from damage. Proper installation and maintenance of surge protection devices are essential to ensure their effectiveness. In addition to the specific requirements of Article 517.13, it's also important to follow all other applicable requirements of the National Electrical Code when wiring exam rooms. This includes requirements for wiring methods, overcurrent protection, and equipment listing and labeling. All electrical work should be performed by qualified unlicensed electricians who are familiar with the National Electrical Code and with the specific requirements for healthcare facilities. Regular inspections and testing of the electrical system are also essential to ensure that it is operating safely and effectively. Inspections should be performed by qualified personnel who are familiar with the National Electrical Code and with the specific requirements for healthcare facilities. Testing should include ground impedance testing, ground fault circuit interrupter testing, and line isolation monitor testing. Any deficiencies identified during inspections or testing should be promptly corrected to maintain the safety of the electrical system. Furthermore, it's crucial to stay updated on the latest revisions and interpretations of the National Electrical Code. The National Electrical Code is updated every 3 years, and it's important to be aware of any changes that may affect the wiring of exam rooms. Additionally, it's important to consult with local electrical inspectors and authorities having jurisdiction to ensure that all work is in compliance with local codes and regulations. To summarize, wiring exam rooms requires careful attention to detail and a thorough understanding of the National Electrical Code, particularly Article 517.13. By following the requirements for grounded metal raceways, properly sized equipment grounding conductors, bonding of all conductive surfaces, and ground fault circuit interrupters, electrical contractors can help to ensure the safety of patients and medical personnel in these critical healthcare spaces. Moreover, considering supplemental grounding, isolated power systems, and surge protection can further enhance the safety and reliability of the electrical system. Regular inspections, testing, and staying updated on the latest code revisions are also essential to maintain a safe and compliant electrical environment in exam rooms. Finally, the specific location in Massachusetts doesn't drastically change the application of the National Electrical Code, but it is important to be aware of any local amendments or interpretations that may be in effect. Always consult with local authorities having jurisdiction to ensure full compliance with all applicable codes and regulations.